Hi, my name is Bindya. I do train OET in Grace Academy. This is my co-star Adra. Today, we'll be demonstrating OET roleplay for you guys. Let's see how it goes. First, the warm session. My name is Bindya Marin Verghese. I'll be your interlocutor for today. My verification ID is 123456. Could you please tell me your full name?
My full name is Athira S. Kumar.
Adra, could you show me your ID?
Yes, ma'am, here it is.
Thank you. Adra, we are going to start the roleplay. But before we start the roleplay, I'll be asking you a few questions.
Okay.
Please note, you are not being assessed in this session. This is to just to get to know each other better.
Okay, ma'am.
Okay. Adra, why did you prefer OET?
OET is an occupational English test, which is very mandatory for nurses to migrate to European countries. So I'm a nurse by profession. That is what I preferred OET.
Good. Okay. Have you ever taken a recent course?
Yes, the recent course what I've attended is BLS,
Mm-hmm.
that is Basic Life Support, which is an in-service education. And by attending the course, I gain knowledge regarding how I need to be in each emergency situation.
Okay. Thank you, Adra. Now we are moving on to your roleplay.
Okay, ma'am.
For your roleplay, you have 3 minutes preparation time.
Okay.
If you have any doubts regarding the roleplay in this 3 minutes preparation time, feel free to ask me.
Okay, ma'am.
Okay. Now we are moving on to the roleplay. In this roleplay, Adar will be taking the position of the nurse and I'll be taking the position of the interlocutor. So the nurse will be talking to the patient about her husband, okay, who is in the ICU. And she'll be answering the patient's doubt, reassuring the patient and explaining the patient about her husband's condition. Let's see how it goes.
Good morning.
Good morning.
My name is Athira. I'm your attending nurse today. Bindya, could you please tell me how are you feeling today?
Well, nurse, I feel a lot better. In fact, my breathing is quite normal right now.
Okay.
But I'm really worried of my husband. He fell in front of me when he came to visit me.
Yes. I know that you might be really worried to see your husband falling in front of you. That is what I came here to update you regarding your husband's condition. He's perfectly fine now.
Really? But I understand that he underwent a surgery. Could you tell me what happened to him?
Yes, as you mentioned, he had a sudden chest pain and he fainted. So we had taken him down where we conducted investigations and we came to know that there was a clot inside his blood vessels which has been successfully removed through a surgery. Now after the surgery, he is perfectly fine.
Really? So you said he had a clot.
Yes.
How did that occur? Is that normal for a person of his age?
Yes, I won't say it is normal for this age, but yes, age is also one factor for the clot formation. And there are other factors too, which can promote to have a clot inside blood vessels. But to explain you detail regarding what are the factors, I would like to ask some questions about your husband lifestyle. So can I go ahead with that?
Oh, sure, nurse.
Okay, let us start about his diet. So could you please tell me what kind of diet he prefers?
Well, nurse, I should admit that he prefers eating food rich in fat.
Okay.
Well, like everything he likes fried from, whether it be vegetables or meat.
Okay.
And meat, he likes to have the fatty portion of the meat. And he has it almost every day.
Okay.
So I think that might be a problem.
Yes, that is also one reason.
Mhm.
But apart from that, what about his activity level? Does he perform exercises?
I'm sorry, nurse. He's very lazy to do exercises. In fact, he spends most of the day in his couch, okay, looking at the television and watching his favorite show.
Okay, so where you mentioned like he's always prefers to sit, could you please tell me what kind of position he maintains? Whether he sit with a crossed leg?
Exactly, he sits with a cross leg. Is that a problem?
Yes, for this clot formation, sitting with a crossed leg is also one reason. When we sit with a crossed leg, what happens? The blood circulation is getting obstructed there, which can promote the clot formation inside the blood vessels.
Mm-hmm.
Okay.
Okay.
And apart from this, what about his personal habit? Does he smoke?
Yes, he smokes around 6 cigarettes per day.
Okay.
And
And what about his alcohol intake?
he doesn't drink alcohol much. In fact, I would say he drinks only when his friends come and meet him. That
Okay.
can be once in a month or so.
Okay. So thank you for your information. So from your information, I came to know that your husband follows a sedentary lifestyle. That might be one reason why he developed clot.
Oh,
Yes, so I would like to suggest some of the measures in which way we can improve your husband's life. So can I go ahead with that?
surely, nurse.
Yes, So let us talk about his diet first. So try to add more vegetables in his diet.
Oh,
Okay.
I can do that. Does it mean that he should be vegetarian from now on and avoid meat completely?
No, certainly not, Vindhya. You can even give meat to him, but try not to give in a deep fried form. Okay? You can prefer either in a baked or boiled way, but try to include more vegetables than the meat.
Okay, so you're saying that I can give him meat,
Yes.
but only in baked form.
Yes, certainly.
Okay, and I should give more vegetables to him.
Yes,
I
certainly.
can surely follow that, nurse.
Yes. And apart from that, the exercises. It is very important that we need to have a kind of exercises in our daily life. A brisk walk for 15 minutes can also benefit him by improving the blood circulations.
Okay, nurse, I can encourage him to exercise every day, like doing some brisk walking for 50 minutes. I can encourage him for that.
Yes, that is good. And about his habit of smoking, what do you feel that you will be able to quit his habit?
I'm not really sure of that, nurse. He has been smoking for quite a long time, and I don't think I can help him with that.
Okay, no issue. I can help you. I can enroll him with Quit Smoking program, the program which they'll give information regarding how we need to quit the habit of smoking. And in this program, there are other people who have already overcome the habit of smoking. By sharing their experiences, I guess we'll be able to help your husband in order to quit this habit.
Well, that would be great, nurse.
Yes.
Thank you so much.
Yes. So these are the some measures which your husband's supposed to follow after the discharge in order to prevent the future risk of clots. So will you be able to encourage your husband to do this?
Surely, nurse. Nurse, is there anything else I should do for him to minimize clotting risk in future?
Yes, after discharge, it is very important that he need to undergo certain investigations in order to know the blood clotting factors, whether it is there in the normal range or not. So doctor may tell you to maintain a follow-up. So please make sure that your husband attends the follow-up regularly.
Yeah, I can remind him to come on follow-ups every time.
Yes, and when I went through your husband's chart, I came to know that he developed a calf pain previous a week. Is that right?
Yes, that was kind of a muscle cramp, nurse. He complained of calf pain and it resolved immediately. So I don't think that's a problem. Is that a problem?
Actually, that is a kind of warning signs to develop a clot. So whenever your husband developed a pain inside his calf muscle and in the arm, try to seek a medical attention as soon as possible.
Surely, nurse. I
Yes.
never thought that would be a warning sign.
So by maintaining this, yes, we'll be able to improve your husband quality and also we can even avoid the risk of future clots.
Surely, nurse.
Okay.
How long he should stay in the hospital, nurse?
Yes, regarding his discharge now is perfectly fine, but might be within a week he can get discharged from the hospital.
Only a week?
Yes.
I really want to see him. Can I meet him right now?
Yes, Vidya, I know that you're eagerly waiting to see your husband, but see, this is a hospital environment and your husband is in the other department and you're also my patient. I'm supposed to take care of you. So what I can do is, I can arrange a phone conversation where you can talk to your husband through a phone. Will that be okay?
That would be great, nurse.
Okay, so I'll make an arrangement for that. Meanwhile, please, you make sure that you're taking a proper rest. If you need anything, you can just press the bell. I'll come and attend you.
Surely, nurse. Thank you, nurse, for updating me about my husband's condition. You know, it means a lot to me.
Okay, thank you, Vidya.
Thank you. Now, this is the end of our role play. I hope it was informative for you guys. If you have any doubts, please comment in the comment box. We'll try to help you. Thank you.
Thank you.